Hello, I'm Amy McGorry. A $9 million settlement in the Thomas Valva case delayed again. It comes after Valva's mother raised new concerns over how the money would be split between her surviving children. Payments are now not expected to be released for another month. 8-year-old Thomas died of hypothermia in 2020 after being forced to sleep in his father's freezing garage. His mother sued Suffolk, claiming officials ignored warnings her son was being abused. Hundreds honored a CVS worker stabbed to death on Christmas. Under your wings. A vigil was held last night for Edison Sine Jr. The 23-year-old was killed covering for a co-worker in Lindenhurst.
The brutal and senseless way he was taken from us has left a space in our heart that cannot be filled.
John Palacio is accused in the killing. He pleaded not guilty and is expected back in court tomorrow. Police arrested this Wyandanch woman for an alleged hit and run. They say Heidi Zelaya Almendarez hit Octavio de Jesus Espinal Cime as he crossed the street in Freeport last month. Zelaya Almendarez pleaded not guilty to charges of leaving the scene and tampering with evidence. See Newsday's year-long investigative series looking at Long Island's dangerous roads. It's on Newsday.com. Only in Newsday, a North Shore village will soon celebrate its 100th anniversary. A committee was formed in Nissequogue to plan events around its centennial, including a fun run and involvement in Smithtown's summer concert series. Nissequogue was the site of the town's original colonial settlement. And checking out your Tuesday weather, warmer temps have come and gone. It's back to being cold and very windy. There's a wind advisory in effect until 6 tonight. Gusts could reach nearly 50 miles an hour, making it feel like the teens out there. Calmer winds for New Year's Eve, but it'll feel just as cold, so bundle up if you're going to watch the ball drop. After midnight, there's also the chance we could see some snow. New Year's Day is mostly sunny and cold. Monday, a chance for rain and snow.
Long Island weather is brought to you by PTRC.
For months, Newsday has focused on our dangerous roads and the impact they're having on Long Islanders. Now, a look at finding solutions. Transportation reporter Alfonso Castillo moderated a town hall event.
We're all here tonight to start the discussion of what can be done to make Long Island's roads safer for all of us. Let's begin with this question. So the idea here is to find solutions for Long Island's dangerous roads. But I guess we should begin with, what does success look like, right? When you're talking about a region with 3 million people, more than 2 million registered vehicles, what does it even mean to fix Long Island's dangerous roads? And why don't we start with Robert at the end?
In the average year, there are around 40,000 fatalities throughout the country. Imagine if that was happening on airplanes. That'd be like one and a half 747s going down every week. All the airplanes would be grounded, there'd be investigations, that would not be tolerated. But we are in this country tolerant of this high level of fatalities and injuries. We have to have a major culture change so that we do not tolerate these things. We are among the industrialized nations, one of the worst around the world as far as rates, crash rates, fatality rates per 100,000 population. And it is unacceptable. We have to change our mindset. Bottom line.
Alyssa, I know you've worked on this. What do you see as, I talk about realistic solutions, but do we even need to aim for realistic?
Success would be something where you feel comfortable letting your kid walk to school. You feel comfortable with your elderly grandmother walking to the grocery store. Have a place where roads aren't threatening and fear-inducing, where you feel comfortable that that just getting around your own community you're not taking your life into your hands.
I do want to send everybody to our Dangerous Roads series. In addition to all the stories, great work that Peter and others have been doing here, our data team has been compiling all kinds of data. We've got a heat map of every crash on Long Island going back to 2022. You could see how your neighborhood fares compared to the rest of Long Island. We've got databases on fatal crashes for the year where you could get information about the drivers, about the victims, links to stories, information kept by police. I've got to plug my newsletter. The Dangerous Roads newsletter goes out every Tuesday, completely free. It is a mix of both reporting and some personal stories, anecdotes, stuff like you've been sharing throughout the night. So I encourage you to do that. You can do all of it over at newsday.com/dangerousroads.
Now you can watch the entire town hall discussion on newsday.com. Just click Get More below the Newsday TV video box.
We're getting a closer look at one of the financial challenges facing Nassau University Medical Center. Last year, more than 85% of patients at the East Meadow Hospital were on Medicaid or Medicare. That's higher than any other Long Island hospital, and it's contributing to NUMC's financial issues. Joining me now to talk about this is Newsday investigative reporter Peter Dioria, Wendy Darwell, President and CEO of the Suburban Hospital Alliance of New York State, and Jeffrey Kraut, Assistant Professor at the Zucker School of Medicine for Health Policy. We appreciate all of you being here with us. Thank you so much. Peter, we want to kick off the conversation with you. You analyzed the state hospital data from 2024. Tell us what you found.
Sure. So we looked at what's called discharge data. That's when a patient is admitted to a hospital and then discharged from that hospital. And we compared all the different hospitals on Long Island, both Nassau and Suffolk counties, to one another. And we found that Nassau University Medical Center treats a greater percentage of patients on public health insurers, that's Medicaid, which covers low-income people, and Medicare, which generally covers older people. Nassau University Medical Center has the highest percentage of those patients on Medicaid and Medicare, than any other hospital on Long Island, especially Medicaid. So in 2024, 57% of the hospital's discharges were covered by Medicaid, and then total Medicaid and Medicare, that accounted for 85% of the hospital's discharges.
An important hospital for a lot of Long Islanders. Jeffrey, I want to talk to you about this. What role does NUMC play in Long Island's healthcare ecosystem, so to speak?
No, the role that it plays is the same role it's been playing since it was conceived back in 1931, when the enabling legislation, essentially the voters in a 3-to-1 vote, chose to build a hospital to primarily take care of the indigent and the poor. Remember, this was a time we didn't have Medicaid, we didn't have Medicare. It has been playing that role for the past 90 years since it's opened, that it's always been a safety net hospital, if you will, taking care of those that are underinsured, uninsured, new to this country, who have had trouble getting access. And in that role is because that has been its focus and its primarily mission. It tracks a large number of people from the communities on Long Island that have issues with social determinants of health, high poverty levels, high unemployment, who may not be able to be insured or have other choices.
Well, Wendy, NUMC accepts a high number of emergency and psychiatric patients. We know that. You say other hospitals just don't have the infrastructure to treat those issues. Why is that?
Well, other hospitals certainly are treating psychiatric patients, all have emergency rooms. It's a matter of capacity. NUMC, in addition to being a core essential service provider in the county, does provide a very high volume of the psychiatric inpatient stays and very high volume, I think almost 70,000 emergency room visits a year. So it's essential that they continue to be a strong and growing institution, but it's also essential to the entire community, because when you look around the region, it would not be possible to absorb a patient load of that volume for any of the other hospitals in Nassau County. Just to give a sense of perspective, the last time a hospital closed on Long Island was Long Beach Medical Center after Hurricane Sandy. And it was a smaller hospital for sure, It did provide inpatient psychiatric services, but it had 24 beds, not 150 beds
150,
like
yeah.
NUMC does.
Right.
And frankly, was operating at pretty low capacity for many years before it had closed. And so that was a different story, trying to absorb that kind of patient volume when you have now Mount Sinai, South Nassau, 8 miles away, was a very different thing than having that level of patient load be absorbed elsewhere within the county. So for all of the reasons that Jeff just said, and on those two particular areas, it is essential that NUMC be able to continue providing those services.
Yeah, it would be a struggle. Peter, so what challenges do Medicaid patients face when they're trying to get care that privately insured patients might not? Explain that for us.
Sure, and just to Wendy's point, the psychiatric inpatient patients, behavioral health patients, are sort of disproportionately insured with Medicaid. So that's like another factor kind of playing a role here. Just to be clear as well, if you have an emergency and you go to a hospital, they'll treat you. You will get the care that you need, sort of on an emergency basis. When it comes to, say, follow-up care, maybe specialties, sort of non-emergency care, trying to get appointment with, a dermatologist or another specialist, that's where things can get a little tricky. That's based on my conversations with folks at federally qualified health centers. That's a type of health center that treats all patients regardless of insurance. Uninsured, charges a sliding scale depending on need. And what they told me is NUMC really serves, NUMC as a safety net hospital really serves a lot of these patients because it's really hard for Medicaid patients to get that specialty care, to get that follow-up care, all over. A lot of doctors, a lot of practitioners might just not take Medicaid, and NUMC says, we'll take everybody.
Well, another concern right now across the nation is that there's a lot of concern about these upcoming Medicaid cuts. So, Wendy, how will that affect our Long Island hospitals, specifically NUMC, who treats a lot of these patients with Medicaid?
Well, there's reason to be very seriously worried, but we don't actually have the full answers to that yet. What the federal tax bill did last year was really change the framework for how Medicaid is financed. But because Medicaid is a state and federal partnership program, it's left to the states then to figure out how to absorb those cuts and how to change our programs. We are lucky in New York that we do have so many great coverage options in the state of New York, but that really relies on a foundation of having a strong Medicaid program and a strong federal partnership. We're now looking at, when fully phased in, $13 billion a year in Medicaid cuts to the state. And that is going to mean that the state has to make some very hard decisions. They're still working through some elements of the law with the federal government that might mitigate the damage, at least for a few years. But we are going to be really having to look at major changes to the way the Medicaid program functions in New York State. And so for any institution that has a significant Medicaid patient load like NUMC, that's going to make things even more challenging. As it is, the fundamental problem with Medicaid is that it reimburses providers at far less than it costs to provide the care.
Right, so let's talk about that with
Okay.
Jeffrey. Yeah, we want to have you, Jeffrey, kind of break that down for us. What is really that financial challenge of treating these patients on government insurance?
Yeah. So unlike Medicare, which there's a national framework for payment systems, Medicaid is primarily a state-run program with federal support, but each state can define its benefits and the costs that it's going to pay for, or the amounts it's going to reimburse hospitals for. In New York State, on average, for every dollar we spend on a Medicaid patient, hospitals are reimbursed at 70 cents. So you lose 30 cents on the dollar. And Medicare, it's slightly less. It's probably about 12 or 13 cents on the dollar. But from government payers, they do not pay the cost of care. So for an institution that has 80–90% Medicaid, Medicare, such as at Nassau University Medical Center, they have no other way to essentially break even or even make a slight profit, which really is not a profit. It's to invest back into new programs and services. Other hospitals attract a larger amount of what's called commercially insured patients. And those patients pay not only the fair price of the cost of delivering care, but there's a profit that's built into it that's reinvested into the hospitals. Nassau University Medical Center does not have that same ability that other hospitals do.
Right, they're just continuously losing this money.
Yeah.
Peter, you recently reported that NUMC has one of the worst financial positions of any hospital in New York State. So is there any indication that it can turn things around?
I would say that people are trying really, really hard. There's been some sort of governance shifts at the hospital recently. We have an interim CEO right now. We're getting a new CEO, I believe, at the beginning of the new year. And everyone has maintained we're going to keep this hospital open and we're going to do what it takes to keep it open. So, you know, I'm not in the books of the hospital at this very moment, but I know that the people running it and the community around it are really invested in keeping this place running.
Could I just make a point here?
Yeah.
Since Nassau University Medical Center was opened as Meadowbrook Hospital in 1935, it has never, ever broken even. It has always needed subsidy. Earlier, it was subsidy from the county, and now it's subsidy for the state, as almost every other safety net hospital in New York requires state subsidy above and beyond what it pays to Medicaid. So the expectations here is we are going to have to support this hospital with some sort of subsidy, but it's the value we get and the role it plays in our ecosystem and the accountability for that subsidy is part of the challenge now.
So it sounds like the mindset has kind of always been, we're going to keep this open and afloat kind of no matter what. But Wendy, what does happen when a safety net hospital does close? What would that mean for patients, potential patients?
Well, Jeff's probably got more historical perspective on that around the state than I do, because it's been some time since that has happened. I will say the state is working very hard to make sure that safety nets are open in a number of communities around the state, not just here in Nassau County. I'll go back to something that Peter said a few minutes ago about the ability of Medicaid patients to access care. I want to say first and foremost, no patient should defer getting necessary care for fear of a hospital bill. Every hospital in New York State, by law, by their own missions, has a financial assistance policy. And we as a state have really great low-cost options for people to get health insurance. As he said, it can be more tricky on the outpatient side. And that's because the charity care law does not apply to any other healthcare providers besides hospitals. So care provided in the hospital by hospital employees and hospital-owned facilities, you have the ability to get help paying a bill. So patients who, whether they go to NUMC, whether they go to another hospital, have those options available to them. However, NUMC has developed that relationship with its community over the years. It is really critically important, particularly to its immediate community. And there will be disruption of care. Anytime there is a healthcare institution that closes, or even an insurance network changes, the providers that are in its network, people have to find new primary care doctors. They need to find new specialists. They tend to refer to different hospitals or different clinics or other specialists. And it does cause dislocation, and what we really worry about there is that people will have gaps in their care. We don't want people to fall through the cracks. But as I said, we have issues with capacity in terms of absorbing the patient load, but there is no circumstance, no plan that I have ever seen that would close Nassau University Medical Center. Across the board politically, there is support for keeping that institution open. It has some things that need to change, and I think everybody inside and outside in the institution acknowledges that in order to put it on better footing.
providing a lot of critical care for a lot of Long Islanders, an important conversation to have with our guests. So thank you all for being here with us. As Peter mentioned, a new CEO and president begins in January, so it's something we'll keep an eye on. My thanks to Peter Dioria, Wendy Darwell, and Jeffrey Kraut for being here with us. We appreciate it. You can read more about this story on our website, newsday.com.
Enjoy a luxurious Long Island getaway with no check-in required. Let's go with Carissa Kelman.
If you can't spend the night, then spend the day here at the pool at the Rockaway Hotel and Spa.
Day passes let locals enjoy the heated outdoor pool, cedar saunas, and a cozy winter lounge. No overnight stay required.
Thank God this pool is warm. Even though there's snow on the ground, this is perfect, as long as you stay in the water.
With the pool, saunas, and food and drink service, it's easy to turn a few hours here into a full winter escape.
Enjoy a day with the ladies or with the family. This is the perfect small bite to have by the pool.
You can also add express spa treatments right in the lounge, or go all out with full service at the hotel spa. And if a pool day isn't your vibe, there are ways to unwind indoors.
If you're looking for a relaxing day, all of the spa and salon services here at the Garden City Hotel are open for non-guests, including massages with hot stones.
From massages and facials to a $40 blowout special Tuesdays through Thursdays in the salon, the Garden City Hotel makes for an easy winter spa day without a room key. No need to check in to check it out. For Newsday TV, I'm Carissa Kelman.
Looks so relaxing. Find more staycation ideas on Newsday.com. Click Get More below the Newsday TV video box. See more on these stories on Newsday.com and watch us streaming anytime on Local Now, YouTube, and the other services you see here. I'm Amy McGorry. More local news coming up.
An inside look at Long Island businesses as Newsday presents LI Works. Join Ken Buffa as he samples unique jobs and meets the people behind them. LI Works, now available at Newsday.com/LI Works.